coming, and is Hipec still worth looking into for patients with a PCI over 20?
I think it depends on what disease it is. Um, and I think that's the most important thing is what disease you have. So if you have gastric cancer, if you have colon cancer, and also really what your response is to systemic chemotherapy. So we can downstage some patients with systemic chemo, where I've seen that if you get a good response and the chemo does work very well, I never say absolutely not to anybody. I always think it's worth, even if it's putting a scope in to let you know. I think that's very helpful, and I've done that many times where people have a good response. So what do I consider a good response? A lot of times with patients with peritoneal metastasis, their belly fills up with fluid. Now we talked about that the belly makes fluid naturally, so your intestines can rub against each other and you can digest your food. But what happens is, if the lining of the abdominal wall is all covered with tumor, you still make fluid, but you can't absorb it. So you can fill up with a lot of ascites. And I've seen a lot of patients where they get systemic chemotherapy and that ascites level goes way down. Is that they go from getting a lot of liters, so like 4 to 6 liters drained every 2 weeks. Then all of a sudden they notice they're getting chemotherapy and they're getting it drained once a month. And then they're getting it drained every 2 months. So I think that's very, very promising. And I tend to be more aggressive and try and put a scope or a laparoscope back in these people to see, can we actually do a complete cytoreduction, and if they'd be candidates for Hipec.